to give a kind of early feedback on the impact of the new legislation for the patients. I think globally the message is that it's a bit premature because everything is, well, not everything, but it's really starting now for many patients and many organizations. It's a new era that starts, even if, of course, patients are very interested by side effects. How to involve actively civil society, patients and their organizations is relatively new. When the legislation started to be implemented, we started to review, for example, the tools that member states have to implement to help, in this case, on this slide, patients to report. So this was in May 2012. And you see that at that time, some countries had online tools, others used the printed materials. In others, we could not find information. And 1 year later, the situation has slightly changed. Sorry, Marina, but this was done in April 2013, so right before you joined. That's why you don't appear with the right color, but as soon as I am back in Paris, I will update it. So there are some countries within a year who completed tools and now online reporting forms with printed forms. So the pink is disappearing from the map. There is still some yellow. Peter Arlett sometimes refers to the European decision-making as European spaghetti. I would like to use another image and describe the European lasagna. Because in fact, even when we have reporting tools online on print or printed materials, we don't know exactly what it is, who they were designed for. In many cases, it's a rapid adaptation of the form for healthcare professionals, copied, changed a bit, and pasted for the use of patients. And so we end up with forms that contain terms which are not easy to understand for the patient. So even though there are some progresses, some changes, when you analyze the quality, when you analyze qualitatively what is provided for the patients to report, you realize that there is a huge heterogeneity in the tools. The red spots refer to a network of helplines that operate in rare diseases, but they take calls and emails from non-rare diseases as well, which are being trained to assist patients when they want to report online or with a printed material. We've seen in the UK with the yellow card scheme based on online forms, printed forms, with the assistance of the helpline, how they can complement each other. Not everybody is at ease with an online form, so online assistance by telephone can also help. Patient organizations have also dedicated some resources to pharmacovigilance, just as an illustration of what we've done at Eurordis. There is a section on our website on pharmacovigilance where we have extracted and rephrased most of the information which we think is relevant for the patients and their organizations. I think we have to be very modest. Since we've put this page live on the web, we have had that many unique visitors, and they've viewed quite a few pages. On this site, we provide, for example, the map of all the reporting tools available in Europe, because we knew before that patients don't know exactly or don't always know that where they can report adverse drug reactions. So here we have a map where they can click and they can land directly to the reporting page or download the document from their country or see the telephone number of the helpline where they live. And we would like to have more of these tools available. This morning, June said a word about the IMI call number 9, and I think I would like to focus on why we think it is also important for patients. And maybe one of the objectives which is important is because the legislation states that the holders of marketing authorizations have to report any adverse drug reaction they hear of, including those on digital media. But how to do that? We know there are digital media owned by the pharmaceutical industry. Others are owned by patient organizations. And we need to think on possibilities and guidelines and policies how to make it happen without the online communities or the digital media feeling all of a sudden there is a kind of intrusion in the privacy of their discussions. So we are very interested by this project because it contains an objective to provide guidelines and policies how to best interact, how to create this interaction between the industry and digital media and patient organization communication tools to make proposals in this domain. And also because, as said before, the tools that already exist sometimes derive from pilot programs which were developed at the beginning of the last decade and are already outdated. We are really calling for a modernization, a kind of a revolution, and the use of all possible emerging technologies, starting from the needs of the patients. And we hope that whoever the consortium will be selected, they start from a panel of patients addressing questions. What do you need exactly that could help you in the domain of reporting falsified medicines, adverse drug reactions, any complaint you may have on the difficulty using the product, or if you think there are positive impact or negative impact of the drug you would like to report. All these need to be brainstormed, use emerging technologies to facilitate the use of these tools by the users. We've asked repeatedly, for example, to have a possibility with smartphone to automatically read the barcode of the package so that all the information on the medicine, the batch number, etc., are immediately captured. And we hope this will now happen. About the joint action scope, I think one important aspect of this joint action, and in parallel with WEBE, is the implementation of Article 102 of the directive. And that article says, invites member states to take all appropriate measures to help patients and healthcare professionals and consumers to report adverse drug reactions. Okay, but what does it mean? Which measures? What are the best appropriate measures to do that? What are the resources needed? If we invite, as civil society is invited to play an active role in pharmacovigilance, we need to think in terms of resources, what is needed to have this effort sustained and on a larger scale than as of today. And I hope the joint action and WEBE will also address these points. It's an excellent opportunity because all national competent authorities are part of the joint action, so there will be possibilities to discuss this. To monitor, to see if there is an impact of the legislation, there is also a tool which I think will be used more largely by researchers. That's the RDR reports website. Here I just extracted 3 slides on 3 different products, and you see that for some of them, there is already a large proportion of the reports which are done by non-healthcare professionals. And that's one example. This is another example. And in the same disease, hepatitis C, another product, where in fact the proportion is different. So we immediately can generate questions, research questions. In which circumstances do patients report more than others? Is it because they have a large network of supportive patient organizations that encourage them to report? Can we in the future see, for example, an impact of the black symbol in the package leaflet on the proportion of reports by non-healthcare professionals? Is it because some drugs were introduced on the market more recently that there are more reports from non-healthcare professionals, etc., etc. I think this tool is an excellent tool to monitor the behaviors and the patterns of spontaneous reporting, and I really encourage all patient organizations to look at the medicines they use for their disease. There is a lot to learn, which is already in the database. One example, it's only one, and maybe that's because I'm based in France that I use that one, which I discovered last week. I was at a meeting where I realized I was very positively surprised to see that patient organizations are already actively involved in working with the national competent authority, and this agency, the ANSM, had a second call for projects specifically to patient organizations, and you see the global budget and the topics for which they called the projects. For example, there is one, the third line, support to reporting adverse drug reactions by patients, specifically calling for helplines to be created, or for those that already exist, to focus some activities in pharmacovigilance and supporting adverse drug reactions reports. And I think this call will be renewed every year. And a very positive aspect here is that patient organizations, by applying for these projects, learn how to work with the pharmacovigilance experts in this agency. And this creates also a kind of professionalization in patient organizations working in pharmacovigilance. I would like to finish by reviewing quickly the recent controversy about contraceptive in France. Many were surprised by the fact that it came all of a sudden in 2013, whereas there had already been guidelines and evaluation of the risk here in 2001, and I think there was also an assessment in 2011 by the Pharmacovigilance Working Party. And all of a sudden, in February this year, there was a kind of wake-up call in France, and I've analyzed how the press, well, 19 general press have covered the issue. As you know, in February, Giant 35 was suspended for 3 months, and the decision of the French agency was in the main headlines everywhere, using terms such as a health crisis just avoided, or we just avoided a catastrophe, a major catastrophe, not only used by the media, but even by pharmacovigilance authorities. In May, after the PRAC evaluation, there was a shift. In the media, it's the European level that was highlighted, and the decision of the PRAC and of other committees became the main information in the press. And I think that is a very encouraging move. I think before this, the European decision level was not highlighted in the media as much as it has been in this case. In May, and this is also something to have in mind, the media covered the opinion of the CMDH using terms to describe what CMDH is as another body, an organization that gathers national competent authorities. And here I would like just to pinpoint a difficulty for the reader. If you read all the press at that time, you had the PRAC, the CHMP, the EMA, the CMD, and then Brussels. It's more than 5 acronyms where some decisions were taken. We know regarding the organization of the decision-making process why it is so, but for the end reader, it becomes a bit confusing to understand why there are 5 different bodies that are involved in that decision, plus the national level. And as I said, then Brussels to add one layer of decision. Controversies often have a utility. Here I would like to highlight the decrease in the number of prescriptions of 3rd and 4th generation contraceptive pills, even before the PRAC and CHMP opinions, showing that healthcare professionals, thanks to the controversy, started to revise their prescription behaviors. And to finish, I think it's also important to see the consequences of the work done and the decisions made in the EU. Here, the press in Morocco that underlined the wise EMA decision and taking on board the EMA opinion to make their own decisions delivering these products to patients. I think the message, the conclusion is that it's difficult in terms of communications if when there are crises, every time we use words like catastrophe or health crisis just avoided, what terms will they use when there will really be a problem? That I don't know. Last week, another one happened and is largely commented in the press. It's because, well, it's due to anticoagulants, because some biologists have reported an unexpected adverse drug reaction, which is an increased risk of bleeding. So it's interesting to see how an expected benefit is turned into an unexpected adverse drug reaction. And again, the terms of health crisis are used by some media. And I think that at some moment, there needs to be to calm down the debate. I've heard at a TOPRA meeting that there are 90 referrals in preparation from France. And maybe there should be some regulation on the regulators' appetite for referrals. And I will stop here. Thank you.
Thanks very much, Francois. And thank you very much for data, information, and so really feedback from the field, as it were, both in terms of what different member states are doing for patient reporting, but also in terms of what the patient associations are doing and so on. Questions or comments or observations relating to the presentation from Francois? Maybe from anything from any of the other patient representatives that might be complementary to? Please, go ahead.
Just a small comment. I think it's really important what you said, Francois, about the role of the media, because in general, the role of the media in health and medicines-related issues is really important. And I think that just generally the standard of reporting on scientific issues is, there's a lot of room for improvement. So that I don't have an answer to that, but it's probably a big issue for patients.
Please go ahead.
I would just like to say I loved the website and what you were doing on there. And in the spirit of collaboration, is there some way that can be made available to other patient organisations to lift rather than them have to design their own, please?
Syndication of tools between patient associations, Francois.
Well, certainly, I think that will be part of the training content of the EUPATI IMI project, but not only. I think we will have to develop common tools, including for patient organizations, and WebA can be one project where we can develop such tools. There are many objectives in WebA which are of importance to all of us. For example, the development of algorithm for data mining in all our social media. I think patient organizations will also have to learn how to use this algorithm, extract data that can be of importance for pharmacovigilance, and share data with the authorities and industry. And we will have to learn, all our organizations involved in pharmacovigilance, how to use all the possible tools, share the one that already exist also.
I have to say I had the same thought when I saw that slide as well, because certainly EMA's website does not list in detail how to report in each member state. We've left it to the individual member states, and we just direct you to their websites. So actually potentially quite a useful tool. Please go ahead.
Good afternoon, I'm Ilaria Passarani from the European Consumers Organization. I would like to come back to two issues that were just raised. The one is about the media. We received a lot of requests from journalists, especially on the Diane case, And in most cases, we had to really teach them how it works and what it means, and we were begging them not to alarm people unnecessarily. But that's what journalists are looking for. They want something sensational, they want the scandal, and no matter, they don't listen. Many times they don't want to listen what you're telling them. So maybe they need a training here, and they need to meet you and your colleagues to be reassured that there are people taking care of this, and that the public should not be scared when there is no risk, in fact, or where the risks are still to be assessed. The second point is on the reporting in the member states, how it actually works. We asked our members feedback on the implementation of the pharmacovigilance legislation, and in most cases they said that they were involved by the agency, that the system is in place. Maybe there are less reports from patients, from consumers than we would expect. But the problem is really arriving till the very end. For example, I look at the European the agency in Italy, at AIFA, which is my country. And in fact, you find the form, which is also very simple, so very easily to fill it in. But then they tell you to send it to someone that is not known, because they ask you to send it to the local health authority, and specifically to the person in charge of pharmacovigilance. And most of the people don't know who this person is. So maybe you fill the form, you find the information, you receive the information from the information campaign, but you don't manage to arrive till the very end. And that is the most difficult part, and that's where member states have to play the biggest role, so to make sure that people can actually arrive till the end of the process. Thank you.
I don't know if anybody wants to respond on the media education issue. I have to say, having worked in a national competent authority for 7 years, then gone to Brussels and then come here, I think it's the member states that are in the front line in terms of media inquiries. We have a very good media operation here, but the real sort of firing line for media tends to be at a member state level. I don't know, Sabine, or whether you would like to give any comment on that.
Well, from our experience, it's collaboration. So we try to be proactive and inform media at the very beginning of the thing that is going to be published. And also we have a specialized department in our agency for relations with media. So they're well trained, and they're like the first line communicating with media.
Yeah, what we have noticed, as for example with the Diane, as soon as there is something that is a crisis or a problem or a safety issue, or it goes much further, for example, an accident with a bus somewhere, immediately everybody gets very national. So there were no Dutch people in the bus, whether or not that is very important. I mean, but we tend to notice that often the media attention is very focused on were there Dutch cases of VTE, were there Dutch fatalities for a drug or something like that. So we are, and very often it's on a Friday afternoon. So, but what we also have noticed is that because EMA is coordinating more of the communication, we have earlier lines to take, we are better prepared, and in being better prepared, it's easier to discuss with the media what is happening, and that often takes away the urgency for them to communicate in a not always moderate way, I think. So I think we're making progress, but it is a very difficult issue, and I was very interested in hearing the very nice example of the French issues with Diane. So thank you very much for that.
Juan, and then maybe Val.
Thank you very much, Sabine, for this. I wanted to have in mind this exactly. I think coordination maybe is one of the main tools we have to use to try to tackle this. But also I think I cannot agree more that maybe we have to move very much towards this concept of media engagement and media training and education. But also just to say that the system is new. And I think we have seen an evolution through this year. I think also Diane is quite an extreme case, because it was also a lot of discussion within the different member states and different opinions in different in countries, especially in France. So I think we are testing very much this, and we have, for example, other cases such as, for example, the Trazepan, which was also challenging from the scientific point of view, which the communication worked well, and there was not so much confusion at media level. So I think we need to, as Sabine says, we are getting there, or at least we are trying to develop better this dialogue with the media. But also I thank you very much, Hilaria, because I think this is also the role that what we expect from patients and consumers organizations, that they help us as well when they receive comments from media to try to ensure that the same message coming from here is delivered.
Thanks very much. Please, Francois.
Think
Sorry, Val.
Yeah. One positive thing is that most of the press copied and pasted the exact text of the main press agency, the AFP, and they didn't modify because it was quite technical. The problems comes from the headlines, the main lines, the title, and the part of the article where the journalist writes an opinion. They always have an a priori opinion to express, then they interview people and they only take from the interview what will serve the message they want to pass. And that's, I think, where and I don't know which kind of training can address this type of journalist behaviors, but that's where most of the problems are when they are. But I agree there are other examples that where the communication went very well with no confusion.
It's absolutely true that often the content of the article is quite accurate, but the headline writers then give a misleading impression before you start. Val, is it on the same topic? Please.
Yes, it is. It's sort of like a general comment, really, from a somewhat old dinosaur. But I think it's a shame that institutional memory gets lost sometimes, and quite often these issues are a law of unintended consequences in many respects. And I certainly remember the original issues, and you may have been at the MHRA at the time, Peter, but the original oral contraceptive pill debacle represented as double the risk of an almost negligible risk. But what then happens is, people stop taking the women stop taking the pill. Hey, and guess what happens to the termination rate? And that's not without risks either. And I can think of several other examples. So I think media have to kind of understand that there may be really quite significant consequences of the actions taken. And it's kind of sad that Diane kind of occurred when, and I'd be quite interested to see what happens to the abortion rate after all this debacle, because certainly back in the 90s, it went up quite significantly, and that's not without risk.
Given that we're talking about media in general, as a follow-on from Francois' presentation, but June, given that the PRAC is at quite a sensitive stage in its assessment of combined hormonal contraceptives, I think what people are sharing with us is there clearly are quite a lot of challenges ahead, but also perhaps lessons learned from the past. I don't know if you had any views on that.
Well, thank you. That really does fit with the actions that we're taking in a small working group together with the communications leads in the EMA, and have been for quite some time. And in fact, there have been regular updates. I think the, if you like, quite reassuring messages that have been put out via the EMA website have helped to keep this under, if you like, some form of, yes, we're looking at everything, but no new evidence, and these are messages that we'll keep reiterating. Clearly, the referral procedure will finish this month, and the test will be how we manage the next 3 or 4 weeks. But I do think there's a lot of thought been put into this. We're listening, we've been to the European Parliament, we're listening to what people are telling us, and we really must manage this. It's going to be a big test of the system. Thank you.